So risk factors in heart failure, a lot of these are similar to risk factors for heart disease overall. So, but there are some that are very specific to heart failure and CHF, congestive heart failure. So as we talked about, age, having hypertension, that's why you want to have that under control. Past heart attacks, as we mentioned, that heart tissue dies. So that heart failure can result from the dead tissue in the heart. Diabetes, people who have heart valve diseases. There are some genetics. Obesity, especially people that are morbidly obese, their heart has to circulate a lot of blood. So that puts a lot of strain on the heart. Lung disease, kidney diseases, sleep apnea, certain congenital heart defects, if they're untreated or if surgery was not successful, can result in heart failure. There are different heart muscle diseases, viruses that can attack the heart, genetic conditions that can affect the heart, hypertrophic cardiomyopathy, that is a thickening of the ventricular septum, and that is a leading cause of heart disease and sudden death in athletes. So there can be, heart muscle diseases, hyperthyroidism. So the whole metabolic rate is elevated, and that can cause damage to the heart. People who have abnormal heart rhythms. And interestingly, if you look at the toxins, chemotherapy, we'll talk about this when we cover the cancer section, but people who've had any type of chemotherapy, particularly certain types, they're at risk for heart disease and heart failure, not only while they're undergoing treatment, but in the long term. So that's something that always has to be monitored. Excessive alcohol intake, alcoholism can cause heart failure. Drugs, cocaine. So lots of times when, you see a celebrity and they've had sudden death and it appears to be heart related, it is oftentimes alcohol and drug related. Treating heart failure, just like many other heart diseases, what works for them? Losing weight, of course, because many people have other lifestyle diseases. Getting a healthy diet, managing their hypertension, that's HTN, exercise, stress management, meditation, avoiding the flu, because if they get any type of infection, that can be really serious. We talked about the medications. So the medications are the same as what we would see with coronary heart disease. Surgeries, they may need a valve replacement, they may have had angioplasty, they may have defibrillators, they could have an artificial heart. If you remember with former Vice President Dick Cheney, he had sort of an artificial heart vest that he had to wear, and then ultimately he received a heart transplant. So people who have heart failure are typically put on the transplant list. Exercise testing for people who have heart failure, using the treadmill or the cycle, very low power outputs to start, so low walking speeds, low watts, low kilogram meters per minute on the cycle, very small increments. So we're not going to ramp them up like we did a good endurance athlete on the treadmill test. Another test, and we'll practice this, the 6-minute walk test. So you mark out a distance and you see how far the person can walk in 6 minutes. And this is something we could easily do on the track for the 6-minute walk test. Count the number of laps that someone has done in 6 minutes. So typically, just like with other heart diseases, so your VO2 max, your functional capacities, so less than 10 milliliters per kilogram per minute, those are people that have the poorest prognosis. And those are ones that may get on the transplant list. 14 milliliters per kilogram per minute. Again, this is their max. So that's the cut point for increased risk. And if they get a VO2 max of about 18 milliliters per kilogram per minute, about 5 METs or higher, then that's going to be a much lower risk as far as heart failure is concerned.